Some other things, all the patients that had central symmetrical symptoms responded only to movements in the sagittal plane. And I think in the spine that's understood and talked about, but in the periphery, I've never really heard anyone say that. And
yeah, when I read that, I was like, that's so interesting. I never thought about it. Now I'm going to start paying attention to that movement, start paying attention to the lateral. And I was just talking to you today. I just applied that today with the lateral pain. It worked with extension, with deviation. So I was like, well, I'm going to start paying more attention to see if the pattern repeats. Yeah. Because of what you just wrote. So I was like, that's interesting. It's a good thing to pay attention.
Yeah. Absolutely. I've had a lot of people that thought that was really interesting. And after I got all this data, that was like the least interesting thing to me. But I think it's quite relevant because, yeah, if you have someone with central symmetrical symptoms, you're probably not going to spend a lot of time moving into lateral, into frontal plane movements or lateral movements. So I think that's helpful. Not set in stone. And if you do have lateral symptoms or unilateral symptoms, you often will respond to a sagittal plane movement also. So I guess I just want that to be said. That wouldn't indicate that you immediately go lateral. That would be kind of similar to most people in the spine have unilateral symptoms, and most people respond to sagittal plane movement. But if that's plateaued, there's the indication to go lateral.